So this is our family.
I'm an acupuncturist.
My name's Emily, I'm a chiropractor.
Or is our son.
And our daughter Annie was born in March.
Our lifestyle is definitely unconventional for most people. We don't want to be normal. So this year is a special year for us, and we're inviting you into our lives to get a glimpse of what we do.
What is your name?
Well, Dr. France Chevalier.
Dr. France Chevalier, where are we?
Well, in my dental clinic.
And what do we do today?
Well, today, you wanted that I remove your mercury filling preventively, and so that's what we did, and went really well.
Okay, and why would someone like me want to remove a mercury filling?
Well, that is part of a big concern actually. There has been a lot of discrepancies with different opinions worldwide. The fact is that there are some regulations that are every year discussed by the ADA and the FDA and even Canadian Dental Association. And as they say, mercury is safe and it doesn't cause any problems. But back in 1994, when I graduated from University of Montreal actually, there were some kind of regulations about the use of mercury. So actually for pregnant women and for children, it was suggested no more than 2-3 restorations because it could cause some side effects.
Hello everyone. So I might look a little bit funny if I smile. And this side is all frozen. That's because I just came back from the dentist. And that's what we're going to talk today about. We're going to go about talking about the health of what goes on in your mouth and your teeth. And when I was a little boy, I basically had a cavity and I had a mercury filling, and I went on going on for many years without realizing that there could be some problems with mercury fillings. But recently I was exposed to that idea that mercury is a very toxic, it's a poison, and it's a very toxic element. And it's banned, and it's been banned in so many areas. And many people, you might even have mercury in your mouth and not even realize it. So that heavy metal can cause, what happens is that it can, for some people, they have a broken tooth, and part of that mercury can fall and they can swallow it and it can stay in their body. And other people, what happens is that over time those fillings, they get old, and tiny little pieces of that filling falls apart. And I've seen pictures of mercury fillings that should have been all smooth, but they're not smooth. They're all rough. They have little holes, and what those holes are little pieces of mercury that were over time absorbed in the body. It goes into the bloodstream. It really affects your nervous system. It's very dangerous. Not something you want to have. Many people have like chronic fatigue, anxiety. They have depression. They don't have a clue why. I'm not suggesting that's the total answer, but part of health is taking care of every piece of your body, and that's one piece that is often ignored. So in a preventative way, I went to see my dentist, and I didn't have major symptoms, but I don't want to wait till I'm 50 and then start feeling lethargic and start having aches and chronic pain and start to wonder, why am I having all these problems? And it could have been from something that could have been prevented. So what I did is I went and I had it removed. It was very pain-free. There's a bit of freezing, but that's fine. And it wasn't that expensive. I was surprised on the cost. But even if, it's our health, and I think it's worth it. And I think it's something that it's an investment, and that's how I see it. If you have mercury fillings, talk to a dentist that specializes in removing them. There are specific protocols that some dentists follow that are a lot safer for you, because they can do things so that you don't absorb some of the gases, you don't breathe some of the gases while they're drilling. And we'll pull up a website and pull tons of links, and there's a lot of YouTube videos on this. But this is Martin, a bit frozen, but I am.
Oh, hold on, let me zoom in.
Okay.
Ooh.
You got it?
Yeah.
I'm mercury free. Woohoo!
Yay! Good job.
All right. See you later.